So pain is defined as an unpleasant sensory and emotional experience. And the key word is emotional experience. So many people argue that pain is actually not really a sense. Our main senses are sound, the ability to hear, taste, smell, and then touch. But pain is really, some people consider it really an emotional experience. And this is why it's so hard to, like, how much pain do you have? We'd be asking, like, how much sorrow do you have? How much grief do you have? How much joy do you have, right? It's very subjective. But the experience is unpleasant. We do know that. Then you have nociceptor is a term. Nociceptor is a sensory receptor in the peripheral somata, sensory nervous stem that produces noxious stimuli. It's basically your pain receptor, right? And then hyperalgesia is an exaggerated response to nociception. So if you touch someone and they're really sensitive, that's hyperalgesia. Hypoalgesia is a diminished response to nociception, so they just don't really have much pain perception. Then allodynia is when non-noxious stimuli are perceived as noxious. And the best way to think about that is if just like light touch causes pain. So if being touched by a tissue causes pain, or if the wind hits your face, that causes pain. So those are stimuli that should not cause an unpleasant experience of pain. So that's the term allodynia. Sensitization is increased responsive to nociception. This is part of many pain syndromes. And then there's receptor sensitization, where the receptor site is getting bombarded with multiple activators, and it becomes really responsive to nociception. There's peripheral sensitization, which is increased responsive to nociception from the receptor to the spinal cord, that initial pathway. And then there's central sensitization, which is increased responsive nociception from the spinal cord to the brain. So when people have chronic pain syndromes and have abnormal responses to pain, they have some degree of sensitization, whether it's the receptor site, whether it's peripheral nerve, or whether it's central sensitization. And then neuropathic pain is pain caused by injury to the nerve. Sclerotigenous pain is pain caused by injury to ligaments and tendons that have their own referral presentation. I'll go over the sclerotigenous maps. Myalgic pain is pain caused by injury to muscles. Myofascial pain is pain caused by fascia around sensitive points in the muscle. And neurogenic inflammation is the neural process by which media is released directly from cutaneous nerves. So neurogenic inflammation happens when there's increased sympathetic tone in an individual, and then their nerve fibers themselves release things like substance P and inflammatory mediators that cause pain. It's really something where it's a phenomenon from brain down, that the sympathetic nervous system actually generates inflammatory responses in peripheral tissues, not the other way around, where you have injury to a receptor site and it's perceived at the brain. And we'll show you some mechanisms and illustrations of that. And then dysautonomia is dysfunction in the autonomic nervous system. And many people that have chronic pain syndromes have a sympathetic tone that's very high, and sympathetic tones increase the release of catecholamines, and catecholamines sensitize these nociceptors. So it makes pain much more painful, or much more of a negative emotional experience when those receptors are activated. Okay, so those are the basic terms and definitions. That kind of gives you a little bit of an overview of the different topics that we'll be going over. Now, before we go further, let's go over some really important concepts related to pain as well. Concept one, the perception of pain is brain-based, right? So ultimately, if you experience pain, then areas of your brain are firing. And we'll go over all the different regions of the brain and how they fire, and some clinical considerations when you see central-based pain patterns. The pain is brain-based. And then people have dysfunction in the brain, or have plasticity and negative plasticity in their brain, they can start to experience pain that may not even be there. And then you have concept number two, which is pain does not equal the amount of tissue damage. So there's no direct relationship with the amount of pain someone feels and the amount of injury they have to the tissue. Some people will be hyperalgesic, just very light amounts of stimulus will cause a lot of pain. And this is important to understand, because if you're looking at pain directly related to injury, you're going to really miss how this works. So you could have people that have all different types of pain expressions, more or less, really based upon the activation and integration of input that's actually getting to the brain and how the brain is processing it. The concept number three, many physiological and psychological variables impact pain perception. A big part of pain perception in the brain is there's a limbic connection, an emotional connection. So they've done research, and I'll show you some of these papers, but if you have increased emotional anxiety, for example, then pain is worse. So think of if you're in a good mood and you hit your toe and it hurts, versus if you're in a bad mood and you hit your toe. You're having experience more suffering when you're in a bad mood because your limbic system is already activated, firing, and then you amplify that with, let's say, injuring your toe. And then concept number 4, chronic pain is due to activation of the pain pathways, lack of activation of the pain inhibitory pathways, or both. So there's actually a really important loop that's involved with the nociception perception of brain signals for pain. So you have input that's coming in to the brain to perceive pain, and then you have inputs from the brain that actually inhibit inputs from the spinal cord. Then you have inputs from the spinal cord that also inhibit pain. So when people have chronic pain syndromes, they may lose either their inhibition mechanisms, or they may have sensitization of the receptor site, or they may have exaggerated responses and perception of the brain because the brains are close to threshold. So all these different variables that we'll talk about. But this is what's important to understand. And if you understand these concepts, then it's not strange to you when someone comes in with chronic pain and it's more than just an inflammatory issue, right? So there's other things that are causing their degree of nociceptive negative experiences.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.